A few days ago, during a wedding function, a gentleman in his 50s walked up to me with a smile and asked, "Do you recognize me?" I've been in medical practice since 1996, 30 years now. Over these decades, I must have seen thousands of patients, interacted with countless people, friends, relatives, colleagues, club members. Faces blur over time, memories fade, so I struggled. I genuinely had absolutely no clue, but he refused to reveal his identity just yet. "Come on, try," he urged. "Don't you remember me?" He began dropping hints, fragments of memories, little pieces of a puzzle I couldn't assemble. I felt completely blank. My face must have given it away because he looked at me with a slight disappointment. And then finally he told me, "We studied together in school in the seventh grade. Then I moved to Dubai, continued my studies there, built up my career, and now I'm settled in San Francisco." At that moment, I tell you, I felt humiliated, embarrassed, not just for myself, but for both of us. This wasn't how a reunion should feel. Had I known beforehand, had someone given me a brief introduction before meeting him, our conversation would have been so different. I could have welcomed him with warmth, recalled shared memories, asked about his life, his family, his journey. Instead, it became an awkward, disappointing encounter. And why am I telling you this? Because this is exactly what happens when a patient walks into my consultation room. Many a times, a patient sits in front of me and says, "Doctor, I consulted you 10 years ago, but I don't remember. I don't have their history in front of me. They don't have their old reports. In fact, they don't have anything with them. If they ask them details, they call their daughter, hand me the phone, and I end up having a conversation with her instead." The patient himself, he remembers only bits and pieces. "Doctor, I take this white tablet in the morning and one with the scort line. It's an orange color. I take it half in the evening. You prescribed it to me 10 years ago." Now, instead of focusing on his current health issue, I am forced to go on a frustrating investigative journey, trying to reconstruct his past, trying to retrieve missing details. And while I do this, my mind is consumed by the struggle of getting the right information, not by the medical problem itself, but by the sheer effort of organizing the context around it. And this is where AI should help step in first. Imagine if before every patient visit, I could get a structured, well organized, chronological summary of their medical history, a story, a one-page story that tells me who they are, their past illness, treatments, allergies, medications, past consultations, and even their apprehensions. Just like how a simple introduction about my old school friend could have turned that awkward moment into an enriching conversation, a well organized medical history would completely change the way we practice medicine. Doctors are not stressed because of diagnosing diseases is hard. We are stressed because retrieving the right information is a nightmare. 80% of our time is spent trying to piece together a patient's story instead of trying to solve their problem. This is the first area, I believe, where AI should help. Not just with fancy futuristic applications, but with the basics. Helping patients maintain and present their medical history in an intuitive, structured way like a story. If we solve this, everything else will follow. And maybe, just maybe, we'll have fewer frustrating reunions, both in weddings and in hospitals. Thank you. See you next time with another episode of The Healthcare Futurist.